Good evening. My name is Dr. Kachiu Lee, and I'll be speaking to you today about what every high school student should know about the journey to a career in medicine. I wanted to take this time to personally thank every one of you guys for being here on an October evening. So to start things off, I wanted to introduce myself. I'm currently the director of BSMD admissions with MedSchoolCoach. I took on this role because I truly enjoy mentoring students and also with helping them on their BSMD application journey. I'm originally from Illinois, and I completed my undergraduate and medical school education at Northwestern University as part of the HPME program. This is their 7-year guaranteed BSMD admissions program. After medical school, I completed my dermatology residency at Brown University and then my fellowship at Harvard University. When I finished with my training, I went back to Brown and was faculty there for several years before I moved to Philly, where I'm currently practicing in private practice and also affiliated with Temple University. The goal of my talk today is to shed a little light on the BSMD admissions process for you guys, and to also contrast the BSMD route with the traditional pre-med route. So the path to becoming a physician is definitely long and can be fairly strenuous. In the traditional route, you start with 4 years of college. Many students often take 1 to 2 years off after college to strengthen their medical school application by either getting a master's degree or completing post-baccalaureate science classes to boost their GPA if they need. Alternatively, some students might take a gap year to do research or to participate in more clinical experiences, all with the goal of strengthening their med school application. And then, if you're lucky, you'll get into medical school, which is another 4 years. After graduating from medical school, you'll have to do 1 year of internship, a residency, which can range from 3 to 6 years, and then often a fellowship before you become a practicing physician, or in other words, an attending physician. Altogether, if you add these numbers up, this process can take anywhere from 14 to 22 years. In contrast, with the BSMD program, you'll be able to finish college and medical school in either 6, 7, or 8 years instead of 10 to 12 years. BSMD programs range in length, with some programs being 6 years and some programs being 8 years. Altogether, the process itself of becoming a practicing physician can take 10 to 18 years instead of the 14 to 22 years if you went through the traditional route that I outlined in the slides before. BSMD programs are understandably very competitive, and they have acceptance rates of anywhere between less than 1% to 5 or 6%. Usually, BSMD programs with higher acceptance rates are those programs which are located in states that only take in-state residents. So if you happen to live in one of those states, then you're definitely in luck. I'm going to use the rest of this time to talk with you about what BSMD admissions programs look for, and I'm going to contrast that with going the traditional route, or going to college first and then applying to medical school. Since every student who applies to a BSMD program is very qualified, I like to break up the applicant profile into a few categories. As you can see on my slide, these categories include their numbers or their grades and test scores, their community service or other extracurricular activities, participation in research, clinical experience or physician shadowing, as well as leadership and awards. Let's start by examining each of these categories. Starting off with grades and test scores, these numbers that I presented represent the range of scores and criteria which successful applicants need to have. Remember that top-tier programs often will have higher averages or requirements for SAT, ACT, and GPA scores, whereas mid-tier programs might have slightly lower numbers. Besides your numbers, admissions committees will also look at your transcript or at your course load. They like to see a good load of math and science classes to demonstrate that the student can handle a heavy STEM-based course load. At the same time, they also want to see a good sprinkling of non-STEM classes to make sure that the student is well-rounded. Specific programs will have other requirements, such as a foreign language requirement, so it's important to check with each program to make sure that you've met the requirements before you apply. In addition to this, admissions committees like to look at your AP course load as well as the AP tests that you've taken. also to demonstrate that you can carry a heavy course load and do well. Next, we're going to move on and talk about community service and extracurricular activities. So with community service or extracurricular activities, it's really quality that counts over quantity. I would much rather see you have a small handful of quality long-term activities in which you are able to attain a leadership role than to see you participating in a dozen different activities in which you participated only for a year or so as a member with no leadership roles. It's important to participate in something that you're truly passionate about, because if you're really passionate about that club or that activity or that community service, you're going to be able to demonstrate continual long-term commitment that results in a leadership role or other meaningful project. When I look at leadership roles within these types of activities, I'll also look at whether the leadership role has local, regional, or national prominence. So for example, if you were participating in civic engagement roles, serving on the student council would be an example of a role that only has a school-based prominence. Serving on the mayor's council would be another example of a role with a local prominence. Roles that have regional or national responsibilities will have more prominence than school-based or local roles, and they'll be considered highly by the admissions committee. So thus far, we've talked about grades, community service, and extracurricular service, and we've also started to touch a little bit about leadership. Next, I'm going to move on and talk about the importance of research. So it's very important to at least dabble in some research. You don't have to devote every single summer to conducting research, but you should at least have some experience with doing research. Conducting research itself is important, and getting publications will help your application even more. These publications will show the amount of work that you've put into the research and that you can actually produce quality research in a short period of time. You can have a journal publication, or you can even just have an oral or abstract presentation, which is often more realistic for someone who's only done a summer of work here and there. When you're looking at research positions, it's important to understand what your role will be in that research project. Are you working on your own project, or are you really working in a supportive role to help someone else further their research project? If you're working on your own research project, then you may be eligible to enter some national science competitions, which will greatly help with your BSMD application. In order to find research positions, you can look at your local universities for possible positions that are open, or you can apply to some highly regarded summer research internships. I often discourage students from applying to what I call pay-to-play internship programs, which are programs where you have to pay thousands of dollars or other exorbitant sums of money just to conduct some research. In those programs, they're often using students to make money for the school or for the research program, and students often don't come away with a meaningful project. Moving on, we've talked about grades, community service, and extracurriculars, as well as research. Next, I'll talk about the importance of clinical experience and physician shadowing. Of all the aspects I've talked about so far, clinical experience and physician shadowing is probably one of the most important. It's going to be really hard to convince an admissions committee that you want to be a physician if you've never had any clinical experience or shadowed a physician to see what they do. It's best to get as direct as possible patient care. And what I mean by that is that it's best to actually have some patient responsibility on your own. And you can do this either through getting certified as an EMT, where you will actually work with patients. You can do this through working at a nursing home where you're caring for elderly patients or working in other aspects in the nursing home. Or you can do this by volunteering in direct patient care roles, such as in the emergency room, in surgical centers, or elsewhere within the hospital. It's also important to shadow physicians from different specialties so that you can understand the breadth of medicine. Again, it's hard to convince the admissions committee that you want to do medicine if you haven't really seen what medicine looks like from different specialties and from different environments, whether that's shadowing a primary care doctor or whether that means shadowing a surgeon. By shadowing in different clinical environments, you'll understand what a doctor does as an inpatient doctor, or in the operating room, or in the emergency room, or as an outpatient doctor. Moving on, the final category that I look at when I look at a applicant's profile is I look at their leadership and awards profile. We've already briefly touched on the importance of having a leadership role, and it's probably easiest to get a leadership role through a community service or extracurricular project that you're doing. Again, when I look at leadership roles, I look at whether it's a school-based, a local, or a regional, or a national leadership role. When I look at awards, I look for awards on the national level. It's easy to get awarded awards within your own high school or even within your own region by the city. But if you have awards on the national level, either in science, math, history, or art competitions, it really means that you really did that much more or went that much further with that extra mile to get that award. It's okay if your award isn't in one of the STEM fields. You can have an award that's in history or in art, and that's equally well respected by the admissions committee because, again, we're looking for applicants that are well rounded. We don't want a bunch of people who only know how to do math and science. We want someone that really understands the breadth of the liberal arts, and that means also looking into history, art, or other liberal arts types activities. Once you've been fortunate enough to get accepted into a BSMD program, you'll have to consider your options. And the things that I tell students to look for when they're considering a BSMD program is to look at which college is the right fit. What is important to you as a student? Do you want to be in a college that's relatively small, mid-size, or large? A large university would be a state-based school that might have 30,000 students. A smaller school might be a school that only has 3,000 or 6,000 students and have a more intimate feel. The culture, the location, the class sizes are also very important, as well as pre-med opportunities for advising, extracurricular research, and shadowing opportunities. You don't want to negate the importance of mentorship because throughout your college experience, even with a guaranteed spot, it's important to have a good mentor that will help you find activities and experiences that not only will help you grow as a person, but that will help you become a good physician. Next, I wanted to contrast the BSMD route with what you would face with the traditional route. And this is only a very brief overview of what applicants have to go through when they go through the traditional route. When I say traditional route, I'm talking about going to college first as a general pre-med student, and then after college or during the last years of college, applying to medical school. So what happens with the traditional route is that you initially start college as a pre-med with hundreds or maybe even thousands of other students if you're at a big state school. Then the weed out process starts. You take organic chemistry as well as physics and other pre-med courses that are designed to weed out students who just don't have the chops to get the good grades or to stay in pre-med. Once you finish those prereqs, then you get the honor of taking the MCATs, which is a test that you have to take before applying to medical school. After you get your MCAT and you get your scores back, that's when you get started on your application. And once you put together a good application, that's when you can get into medical school. Often, the required prereqs for a pre-medicine student ranges from taking biology to chemistry to physics with lab to other courses like English, psychology, or sociology. Each school will have different requirements, but in general, this is a pretty accurate list of the courses that you'll probably have to take. And again, you'll see that these courses are mostly STEM focused and have a lot of lab components, but you'll also see that schools like to emphasize taking some liberal arts courses, such as in English, sociology, or other types of courses. Again, we want students who are going to be good doctors who are well-rounded, not a student who's going to be a doctor that only knows how to operate in the realm of math and science. Once you've done all of that, you're ready to apply to medical school, but not quite. So on the national level, only about 40% of applicants who apply to med school actually get in. So that means that 6 out of 10 applicants have done all the work, put together an application, but they don't actually get admitted to med school. In 2019, you can see that across the nation, there were roughly about 53,000 applicants to medical school. Of these applicants, only about 21,800 of them or so were actually accepted to matriculate that year. So even after doing all of that work, your odds of getting into medical school is not great, which is why going to a BSMD program is so appealing, because you have a guaranteed spot in that medical school. From the moment you get into a BSMD program, you know that that medical school is reserving a spot for you as long as you can fulfill maintaining the GPA or some of their other requirements. When you're putting together an application for medical school, it's important to look at what your extracurricular activities are. And you'll see that for these activities, they're very similar to the activities that we talked about on the BSMD side. However, because you've had a little bit more time to focus on these activities, the admissions committee often scrutinizes your extracurricular activities a little bit more carefully. So they'll look at the level of involvement you have with community service. They'll really expect you to have a lot of experience with clinical work, because as a college student, you're old enough to be able to volunteer in all departments of the hospital or to volunteer in other clinical settings. They definitely expect you to have research, because being in a college environment, you have many opportunities to do research. Whether or not you take the initiative to actually do the research and get a publication will really show whether or not you have the stuff that it takes to get into medical school. And finally, it's also equally important to have physician shadowing. Again, it's hard to convince someone that you want to be a physician if you've never actually shadowed a physician to understand what they do. Putting it all together, this is a general timeline of starting in your junior year of what you need to do to put together an application. And I want you to know how this process really takes a full year to accomplish. So starting in your junior year, you're going to start requesting letters of recommendation as well as study for the MCATs. In the spring of your junior year or in the early summer of your junior year, you're going to take your MCAT and start completing the medical school application and submitting it. Once you submit your medical school applications in the summer, each medical school will send you a secondary application, which has supplementary questions that you have to answer, which are typically essays. If you're lucky, in the fall and the winter and the spring, you're going to get interviews and you'll follow up with schools to give them updates about your application. And then finally, after all of that, you'll get to make your admissions decisions if you're accepted into medical school. So you can see that this is a very long process for the application itself. And there's a lot more steps along the way compared to the BSMD application, which follows the same timeline as the normal college applications. So finally, to put it all together, what are the steps that you need to do to be a doctor if you go the traditional route? Well, you have to prepare and plan, which means you have to pick your extracurriculars, your leadership positions, your shadowing positions, and your research positions carefully, as well as spend as much time as you can in each of those activities. You also have to keep your GPA up, have an awesome MCAT score so that you'll be considered. You have to put all of that together into a great application, and then finally, you have to interview well in order to actually get accepted into medical school. With MedSchoolCoach, our goal is to really help to mentor and to guide you through that process. And what we do is we really try to help you by giving you personal advice with physician advisors. All of our advisors are MDs or DOs, which means that we've all been there. We've all been in your shoes and we've all done what you've done. In addition to that, all of our physician advisors have been on actual admissions committees. And so we've read hundreds of essays, and between all of us, we've read thousands of essays. That means that we're able to really give you an insider's view on what admissions committees are looking for when they're looking at your application, as well as the essays. We also have a lot of ancillary staff support, and we bring years of experience to this relationship. We really believe that with the right mentorship, you can successfully highlight the positive attributes of your application to maximize your chance of getting into medical school, either through the BSMD route or through the traditional applicant route. So I wanted to thank you for the time that you took to listen to our presentation on this October evening. Our phone number and email are on the slide if you wanted to contact us for further information. And with that, I will open things up for questions. So I wanted to thank everyone for, again, being on the presentation with us. I'll start taking a few questions from the chat box. So the first question that I have is, how long personally did you get your MD, and what process did you take to get there, and how long did it take you? And that one is from Kaylee. So I was a BSMD applicant, and I did a BSMD program at Northwestern. So that itself took 7 years. I took a year off to complete my MPH, or my Master's in Public Health. So we're at 8 years there. After that, I did my internship and dermatology residency, so another 4 years. And so we're at 12 years, and then I did another fellowship for another year. So that was so I was at 13 years out before I actually started practicing medicine. Obviously, that fellowship year was optional. It's just because I wanted to further subspecialize within the field of dermatology. So I could have finished in about 12 years instead, but I did choose to take an extra year to further subspecialize in dermatology. Our next question is from Joshua, and it's, how do you find research positions and internships as a high school student? So that's probably one of the most challenging and most difficult parts of this application process. There are several very well regarded research summer internship programs, whether that's there's one at MIT, there's one with the NIH, there's one with the CDC, there's one with NASA. So it's probably best to start by applying to some of these established research programs or internships. After that, probably you can look at, if you live close to a major university, you can look at the major universities that are close to you and reach out to those professors to see if any of the professors there have internship or research opportunities where they're willing to take high school students. And then finally, I think that your own networking connections is very important. So if you have family friends or parents of friends that you know, or colleagues of your parents who could potentially be a resource, don't be afraid to reach out to them, no matter how remote the connection. At least you have a connection, and the worst that can happen is that they say no, and you're in the same situation that you were in before. Our next question is, would SAT and ACT test scores be optional? And that's from William Anderson. So it's really tough to say because, at least from this year, so applicants who are applying currently in the fall of 2020, as you know, a lot of undergrad schools have gone test optional. A lot of BSMD programs have also gone test optional, but not all of them. I think that if the COVID situation doesn't improve and a lot of SAT and ACT test dates continue to get canceled, then realistically they will go test optional for next year's application cycle. I know that it's hard to predict whether the test dates will get canceled, and if they get reinstated and the testing goes back to the way it was pre-COVID, then probably BSMD programs will go back to being test required. What route would you recommend, or what route would you take for a pediatrician job, BSMD or traditional medical route? So both are perfectly good options to become a pediatrician. The benefit of a BSMD program is that you have that guarantee that you're already accepted into medical school from the second you're a high school student. So instead of having, or from the time you graduate from high school. So instead of having to do all of that work again and studying for your MCATs, excelling in all of your classes in college, working to do extracurriculars. Instead of doing all of that again just to apply to med school again, a BSMD would give you a guaranteed spot. But both are perfectly fine for becoming a pediatrician. To become a pediatrician, again, it really just matters whether the quality of the med school is one where you'll get a solid education, you'll place into a good residency. And usually there's enough pediatrician residency positions that that's not an issue. What courses do we take in our first year in university? And that's from Saeed Sami. So the courses that you take during your first year in the BSMD program would be the same as the courses you would take as a first year in any undergrad college. As a BSMD student, you're still required to take pretty much the same pre-med courses that any other pre-med students would take. The difference is just that you have that guarantee. So realistically, you'll be taking a lot of intro classes. You might test out of some of them if you have AP credits, but you'll be taking a variety of science classes, electives, and math courses. What is your recommendation in finding a shadow opportunity for high school students? And that one is from Mary Kenyantha. So, finding shadowing opportunities is also very difficult because if you don't know a doctor, then it's a little difficult to know who to reach out to. So, I usually tell my students that the best thing is to, one, again, tap into the network. If you don't have a network of someone you know who is a doctor, the next thing to do is to go and look at your local hospitals and their volunteering offices. Usually after you start volunteering at a hospital, either, working at the front desk, working in the ER, transporting patients, or doing whatever task they give you, during those volunteering opportunities, you'll meet doctors and you can ask those doctors while you're volunteering whether or not you could shadow them for a day or two or even longer. Sometimes you can even arrange for shadowing opportunities directly through the hospital's volunteering office. So that probably is the easiest way to start. Obviously, with COVID, there's a lot of volunteering and shadowing going on right now. So until hospitals are starting to take more volunteers, that might be on hold. What are some ways to do community service with everything going on right now? So that is from Miriam. So there's a lot of opportunities to do community service with COVID. You can engage yourself in projects related to COVID, whether that's making masks for local hospitals, local homeless shelters, domestic violence shelters, or whether it's making care kits for those types of places. I know that you can also volunteer at food banks because there's been an incredible need for volunteers at food banks. Usually, when you're volunteering at food banks, you're not the one handing out the food, you're just the one helping to unload the food donations off of the trucks from the supermarkets or packaging the food donations into boxes for people to pick up. So there really are a lot of opportunities that are still available. The American Red Cross is still doing blood drives, and they are usually always in need of volunteers. But there things that you can do at home again are COVID related things where you're making care packages, donating them to local shelters. You can also offer to help tutor elementary school children that are within your school system or doing other kind of virtual online activities with them. Do I need to be bilingual from Michael? No, you do not need to be bilingual. Obviously, if you plan on working with underserved population that speaks a different language, it would help, but you definitely do not need to be bilingual to apply to a BSMD program or to apply to medical school. Should we volunteer somewhere specific? Since I want to be a pediatrician, should I consider an internship somewhere that specializes in kids? And that's from Christine. So with volunteering or with shadowing, even though you think you want to be a pediatrician, you don't need to volunteer anywhere specific. And in fact, it would be best if you volunteer beyond just the pediatrician's office or with kids. When you are doing your shadowing hours, it's important that you shadow a wide variety of physicians. If you only shadow a pediatrician, all that tells me on the admissions committee is that you like pediatrics. But do you really love medicine for everything that medicine is? Have you experienced surgery? Have you experienced radiology? Have you experienced psychology or psychiatry or other fields? Do you really love medicine for medicine? Or do you think you just love medicine only because you want to do pediatrics? So it's important to explore the breadth of the field, even if you think you know the type of physician you want to be. Is an athletic award on a national level considered an achievement? So, any award on a national level would be considered an achievement, whether it's an athletic award, a science or STEM-based award, or even an arts-based award. What is the order of pre-med classes that you took for the MCAT? So that will really depend on the school that you go to and the availability of the classes each semester or each quarter, as well as whether you test out of classes through AP credits. In general, you'll take intro classes, so you'll take intro bio, intro chemistry, intro physics, and then after that, you'll always take orgo and some upper level bio or physics class. But your major will really determine which of those scientific pathways or classes you're going to do more upper level science classes in. How do IB classes compare to AP classes? How can you gain a leadership role with national prominence? So, IB classes and AP classes are looked at equivocally in the sense that really they just look at the type of classes you took and the GPA that you got. Both IB classes and AP classes are fairly competitive. So, again, it just matters at the end of the day. Um, Looking at your transcript, if your course load shows that you took a heavy load of science classes mixed with humanities classes and you were able to handle that course load and that overall your GPA was maintained. How do you gain a leadership role with national prominence? Well, that to gain a leadership role with national prominence means that you have to put in a lot of time and effort into one organization. So that could be working with the American Red Cross and working your way up so that you get a national position. That could be working with Future Business Leaders of America and working your way up so that eventually you do get a national position. So it takes a lot more focus to do that. And usually people who do that start being involved in those organizations very early on in their high school years or even earlier. What is the top ranked university for this program? So there's several BSMD programs. It's hard to say which one is the top ranked university because the undergrad school rankings are different than the med school rankings. So for example, Case Western is probably one of the better BSMD programs there. Their undergrad school may not be as toply ranked as Brown's PLME program, but Case Western's medical school is higher ranked than Brown's medical school. So there's a variety of different options, and it's hard to quantify what the top ranked university is because there are differences between the undergrad rankings as well as the med school rankings. Even within the med school rankings, schools are ranked either by research or by other fields like whether they produce good primary care physicians or other criteria. What are specific courses for high school students to take for the BSMD program? So typically, obviously, you should take a wide variety of STEM courses. A lot of programs will also require at least 3 or 4 years of English and potentially some foreign language, as well as at least 1 or 2 units of humanities or arts, whether that's photography or drawing, anything that is kind of non-STEMmy. They do want students that are well-rounded. And so it's important to take a variety of courses that are also not STEM courses. What courses do you recommend we take during high school for medicine? So again, I would go heavy on the sciences, but don't forget about your humanities. Obviously, you need English. Foreign language is also good. And then take a few other humanities classes along the way. We want people that are well-rounded. If I see an applicant who's only taken the majority of STEM classes in English for all 4 years and they have like a 5.0 weighted GPA, I would look at their transcript and think they must be really, really hardworking and really smart because they can handle upper level STEM courses, but can they actually talk to a human being? Do they have those interpersonal skills that you need to actually be a doctor? Because by only taking science classes where you only have critical analytical thinking, you're not developing that humanities or that interpersonal communication skills side of yourself. For those who have narrowed down the kind of majors they'd like to take, um, how might the education process change in terms of the program? So most BSMB programs will allow you to choose almost any major as long as it's within the sciences, or some BSMB programs let you choose any major, period, whether that's journalism or the arts or like art history, things like that. So it doesn't change the process other than that the major that you choose will dictate what type of upper level science courses you do. And if you choose a non-science major, then that means that you're just going to be taking a heavier course load to fulfill the BSMB program's requirements, pre-med requirements, as well as your own non-science major requirements. What specific certifications are required to shadow physicians? So there's no specific certification required. A lot of physicians will request that you're at least 16, and if they are affiliated with a hospital or a larger clinic, a lot of them will ask that you do HIPAA training so that you understand how to protect patient privacy. So you'll be seeing patients. Usually, those are just online training courses, and they'll direct you to those resources. How do I obtain those requirements? So again, once you get a shadowing position, you can ask the hospital or the clinic or the physician himself or herself which requirements their specific institution requires. Shadowing in a hospital or volunteering in a hospital is sometimes much more stringent with the requirements. They might request that you send things like proof of your vaccines and things like that. So it does vary based on who you're shadowing and the environment that you're shadowing in. Can we still shadow even with COVID? So it's become a lot harder with COVID. The majority of my students that I'm working with this year and the majority of applicants right now are not shadowing. Some students are doing some shadowing through telehealth. Basically, they're watching the doctor while they're doing their telehealth appointment, but it's very rare. And so I think that as the COVID situation improves, we'll start to see more shadowing. But again, right now, I think shadowing is not as realistic. Are med school programs just for becoming a doctor, or could I try to get in for something like medical research? So, attending medical school is specifically for the goal of becoming a physician. If you're interested in doing something like medical research, then I think maybe obtaining a PhD specifically in the field that you're interested in, like neuroscience or microbiology, might be more important if your plan is to do research only without any patient contact. How do I recommend high schoolers get internships and job shadowing? So similar question to the one that was asked before. Start with maybe your local hospitals, nursing homes, other medical facilities. Start with their volunteering department, and then from there, once you meet physicians while you're volunteering, you can directly ask them. Or sometimes the volunteering departments um, uh, have opportunities for you to shadow. How do you put together a good resume? So there's several templates out there that you can use to put together a good resume. You can do a quick Google search and find a template for a high school resume. The one that I particularly like is from the state of Massachusetts. It's like mass.edu, and if you search mass.edu plus high school resume, it's a PDF that will pop up that explains how to do a resume. How many AP classes do you recommend taking? So again, it's not about how many AP classes in particular that we look at. And the reason is because high schools vary so much in terms of what they allow. Some high schools will allow you to start taking AP classes as a freshman. So you might take 3 or 4 AP classes as a freshman. And so by the time you graduate, you could have anywhere from 12 or more AP classes. To some schools only let you start taking AP classes, like one class as a sophomore and then a few more as a junior or a senior. So typically we say that you should take at least 5 or 6. More is not necessarily better because it's important to recognize that high schools have different requirements in what they allow. And so admissions officers know that. Um, what is the best advice for a struggling high school student? So it's hard to understand that question, whether that person is struggling with academics, whether they're struggling with mental health, whether they're struggling with just time management. I think that, probably talking with your high school counselor might be appropriate, but I would, it's hard for me to answer that question without understanding exactly what the student is struggling with. What are some good medical school application essay tips? So when you're writing a essay for a BSMD application, it's really important to clearly define why you want to go into medicine. It's not enough to say that you like science and you want to help others. That's pretty generic. You have to be specific about why you want to go into medicine, and you have to show the reader through your essay how you've explored medicine as a career. You have to show them your passion for medicine. I want to be a pediatrician but specialize in oncology. What recommendations do you have that will help me for that? So, to be a pediatric oncologist, it's really doing a residency and a fellowship. So, I would recommend probably going to med school that has really good placement in pediatrics. And then from there, in a pediatric residency, because from there, you will have to apply for a fellowship afterwards. With COVID, several states are waiving SAT and ACTs. What would you recommend for a student who did not take these tests? So, if you're applying this year, there's several BSMD programs that have gone test optional. So, I would recommend applying to those programs. If you're not applying this year, I would still recommend signing up for an SAT or an ACT, because we're not sure if the test waiver, going test optional, is going to be something they maintain next year. If we accomplish an associate's degree by the time we finish 12th grade, will that help decrease the 10 to 14 years of a BSMD? So it really depends on whether the credits that you gained with associate's degree can be applied towards getting a bachelor's degree, and whether the classes that you took related to the associate's degree can be applied to the pre-med classes. If you have an associate's degree in art history, then I would say no. If you have an associate's degree in something more STEM related, it'll depend on each undergrad school's requirements in terms of whether you can transfer those credits. Even if you can transfer those credits, a lot of BSMD programs may not let you graduate in 2 years or so. Say 3 years is more realistic. They may just let you take other elective classes, but again, BSMD programs are looking for well-rounded students, not just students who are trying to shave a few years off of the time it takes to train and be a doctor. Does it matter if we take AP or honors classes? It really only matters in the sense of how it affects your GPA. So if it affects your weighted GPA and bumps it up, then it can potentially make a difference if it affects your class rank, or if it affects whether or not you end up taking that AP class, I mean, that AP test at the end of the year, then it can make a difference. How do you increase your odds of getting into med school? Um, I think it's cliche to say this, but just work really, really hard. We talked about the things that you need on your application. So we talked about research, community service, physician shadowing, leadership, and awards, as well as having good GPA and test scores. Maximizing all of those categories will help increase your odds dramatically. Can volunteering within the medical school field for animals be useful when applying to med school? It can be useful only in the sense that you can say that you worked with a vet or with animals and you realize that you didn't want to work with animals. Working with animals does not tell me that you want to work with humans. So you still need shadowing and you still need volunteering experience with people. What are some ways to keep your head up and have a positive mindset through all the work? It's tough to go through this process, but realistically, if you work hard with your goals in mind, you will accomplish what you set out to do. Even if you don't get into a BSMD program, you're going to get into a good college. And from there, you're going to go and get into a good med school. So there's multiple ways to get to your end goal. A BSMD program is only one of them, and if you decide that that's not for you, you want to go to the traditional route or you want to do another route, then know that you will definitely get there. It just may be a different route than what everyone else is doing, and that's okay. What are some replacement classes you take if your high school does not have AP classes? I would take honors classes, or you can even take college level classes at community colleges or online classes through local colleges. You can also take classes through Stanford Online High School. So that's something you might look into if you want more challenging classes. What path did you take, traditional or BSMD? So I was a BSMD applicant. I was a graduate of Northwestern's HPME program. And so most of my experience has been with working with BSMD students. What advice would you give for time management in terms of the BSMD program in college and onward from there? I would say with time management in general, not just for BSMD programs, it's important to make a list of your priorities and then spend time on the things that you prioritize. If you spread out yourself out too thin by doing too many activities at once, you're not going to be able to get a meaningful leadership position or complete a meaningful project that way. So it's important to prioritize what activities you enjoy doing and what your goals are, and spend your time on the ones that are the most important. I've tried to find a vet office to volunteer at, but they turned me away due to COVID. Um, I do manage the family farm, but will undergrad courses turn me away because I haven't had access to volunteering? So if you're just applying for the traditional route to undergrad colleges, I think having experience on the family farm, managing the family farm, not just experience, is much better experience than most other people have. That's a leadership role. You have real life experience. So I think that's a really wonderful experience, and you don't have to worry about colleges turning you away. How do you not let personal struggles get in the way of academic life? I think that is a very personal question, and I think you have to, if you need help with personal struggles, you have to know where to find the resources for that help, whether that's speaking with the high school psychologist or any other local resources you may have that can, or even the pediatrician that can help direct you to local resources of your area. That is my daughter. Um, so next question. What major do you recommend going in with if you want to get into medical school? So medical schools really look for well-rounded applicants. The majority of applicants are science or STEM-based applicants. And I'm sorry, so the majority of applicants are science or STEM-based applicants, um, but because medical students or medical schools really look for the well-rounded applicants, they also like to take applicants that are not STEM-based, whether that's an English major or history major or something else. Um, I would say that the important thing is you can major in anything, but the important thing is to complete all of your pre-med requirements and get a good GPA. What are BSMD interviews like? Can you give an example of an interview question? So BSMD interviews are often conversations. Sometimes there might be some ethics questions that are asked, and sometimes there might be questions that are related to your personal motivations. So probably the most common example of an interview question is, tell me why you want to go into medicine. If I don't get accepted into BSMD and I take the MCAT and I'm not accepted into medical school, what are my choices after that? So if you're not accepted into BSMD and you take the MCAT and you don't get accepted into medical school, I would say try again. A lot of people reapply to medical school and they get in the second time. What should I do to prepare currently as a high school sophomore? So, again, I would really direct you to looking for clinical volunteering opportunities, non clinical volunteering activities, being involved in extracurriculars longitudinally, doing research, as well as doing shadowing and looking for leadership positions. How many years does it take to become a cardiologist? So after medical school, you have to do 3 years of internal medicine and another 3 years of cardiology fellowship. So that's 6 years after medical school. Assuming that you do undergrad in 4 years and college undergrad in 4 years and medical school in 4 years, which puts you at 8 years, then you're looking at 8 plus 6, which is another 14 years to be a cardiologist. Um, When can you specialize? Like, when do I get to decide I want to be an OB/GYN doctor? So you'll decide that after towards the end of your medical school years, when you're applying to residency, you'll apply to OB/GYN residencies. Do you think it's a good idea to major in psychology if you want to go into medicine or a BSMD program? Yes, I think psychology or any other major is great and is fine. Again, you just need to make sure that you do well on your pre-med courses and you maintain your GPA in those pre-med courses. How does how does a high school I think this is how can it says how a high schooler can prepare to apply pre-med or BS pre-med program. I think that's asking how what can a high schooler do to improve their application. And again, I would direct you to looking into getting research opportunities, clinical volunteering, shadowing opportunities. Almost all hospitals don't take any volunteers until the age of 18. Um, do you have any advice on how my daughter can find opportunities to shadow or volunteering? So, if hospitals around you don't take volunteers until the age of 18, you can look at other non-hospital type of environments, whether that's a nursing home or whether that is a private practice or another type of physician's clinic, whether that's asking your daughter's own pediatrician or asking your own internist if they can get shadowing experiences. If the hospitals around you are strict, then look for other medical facilities like assisted living, senior centers, retirement center, children's programs, um, physical therapy rehab centers that may not be as stringent. Well, this pandemic slightly changed the admissions process for BSMD programs. The biggest change that we've found is that a lot of programs have gone test optional. The other change that we anticipate is that instead of in-person interviews, interviews will probably be done over Zoom. Realistically, some of the requirements like shadowing and extracurricular activities might loosen a little bit because we know that students are unable to find shadowing opportunities when COVID doesn't allow for shadowing. And I think given the time, what I'm going to do is I'm going to wrap up after a few more questions. So, what are your thoughts on an accelerated 6 to 7 year medical program? So those medical programs are excellent. The courses are designed to get you through all of your pre-med classes in 6 or 7 years. For 6 year programs, you're usually giving up your summers. And so over the summer, instead of, going back home and hanging out with your friends, what you're doing is you're taking classes. And so that for some people can be a little bit more stressful. And to wrap things up for our last question, when do you apply to BSMD programs after high school? So you'll apply during the fall of your senior year. The majority of applications are due somewhere between November to December of your senior year. So you're basically applying at the same time as your regular undergrad colleges. And with that, I think we're going to wrap up. So thank you so much, everyone, for being on this call tonight. And please reach out to us if you have other questions that we weren't able to get to, or if you wanted clarification on something else. Thank you.